Welcome. Today we're diving deep into a rare condition affecting the urinary system, urethral hemangioma. This video will cover everything you need to know from its causes and symptoms to diagnosis and treatment options. Whether you're a medical professional, a patient, or simply curious, we'll break down this complex topic into easily understandable information. The exact cause of urethral hemangiomas remains largely unknown. They are generally considered to be congenital, meaning they are present at birth, but can also develop later in life. Several theories exist, including the abnormal development of blood vessels during fetal development or the proliferation of vascular tissue in response to injury or hormonal changes. However, more research is needed to fully understand the underlying mechanisms. Urethral hemangiomas are benign, non-cancerous tumors composed of abnormally clustered blood vessels within the urethra. These vascular malformations can vary in size and along the urethra, from the meatus, the opening of the urethra, to the bladder neck. Their presence disrupts the normal flow of urine, potentially leading to various symptoms. The fragile nature of the abnormal blood vessels makes them prone to bleeding, which is a hallmark of the condition. Urethral hemangiomas are exceptionally rare, making accurate epidemiological data difficult to obtain. They are more commonly reported in children, particularly infants and young boys, but can occur in adults of both sexes. Due to their rarity, it's challenging to determine specific risk factors or prevalence rates within the general population. The limited available data suggests they are a relatively uncommon cause of urethral bleeding and other urinary symptoms. The symptoms of urethral hemangioma can vary depending on the size and location of the lesion. The most common symptom is hematuria, or blood in the urine. This can range from microscopic hematuria, detectable only under a microscope, to gross hematuria, where blood is visibly present. Other potential symptoms include urethral bleeding unrelated to urination, urinary frequency, urgency, dysuria, painful urination, urinary tract infections, and in some cases urethral obstruction leading to difficulty urinating or even urinary retention. Diagnosing urethral hemangioma requires a thorough evaluation and a combination of diagnostic techniques. The process usually begins with a detailed medical history and physical examination. Urinalysis is performed to confirm the presence of blood in the urine. Cystoscopy, a procedure where a thin, flexible tube with a camera is inserted into the urethra, allows direct visualization of the urethral lining and any abnormalities. Urethrogram, an X-ray of the urethra using contrast dye, can help identify the location and extent of the hemangioma. Biopsy, the removal of a small tissue sample for microscopic examination, is often performed to confirm the diagnosis and rule out other conditions. Imaging techniques like MRI or CT scans might be used to assess the size and extent of the lesion and evaluate surrounding tissues. While there isn't a formal classification system with distinct types of urethral hemangiomas based on specific histological features, they can be broadly categorized based on their location within the urethra, e.g., medial, distal, proximal, and their gross appearance, e.g., solitary, multiple, diffuse. Some may be described based on the predominant type of blood vessel involved, such as capillary or cavernous hemangiomas. However, these classifications are more descriptive than definitive. The treatment of urethral hemangioma depends on the size, location, and symptoms it's causing. Asymptomatic, small lesions may be managed with observation alone. For symptomatic lesions, various treatment options are available. These include endoscopic ablation techniques, such as laser therapy or electrocautery, which use heat to destroy the abnormal blood vessels. Surgical excision or complete removal of the hemangioma may be necessary for larger or more complex lesions. Medications, such as sclerosing agents, can be injected into the hemangioma to cause it to shrink. In some cases, a combination of treatments may be used to achieve the best results. Post-treatment monitoring is crucial to ensure the hemangioma doesn't recur. Unfortunately, because the exact cause of urethral hemangiomas is unknown, there are no proven methods to prevent their development. Given the likely congenital nature of many cases, preventative measures during pregnancy are unlikely to have an impact. Focusing on early detection and prompt treatment is the best approach to minimize potential complications. The prognosis for urethral hemangioma is generally good, especially with appropriate treatment. Most patients experience resolution of their symptoms and a return to normal urinary function. However, recurrence is possible, so long-term follow-up is essential. Recent research focuses on improving diagnostic accuracy and refining minimally invasive treatment techniques. Studies are exploring the use of novel imaging modalities and advanced laser technologies to enhance treatment outcomes and reduce the risk of complications. Further research is needed to understand the underlying genetic and molecular mechanisms involved in the development of these rare vascular malformations.